Greetings and welcome to Ask the Doc. I'm here with my wonderful co-host, Dr Umar, and we are going to be talking to a co-founder of NeuroX, who is Dr Umar Farooq, and he is coming from Michigan. So welcome, Dr Farooq.
Oh, thank you so much, Ariane. Thank you for having me. Really appreciate that. Hi, Dr. Ahmed.
Hi, Dr. Farooq.
Before we go any further, let's find out a little bit about Dr. Farooq and how you got to be with NeuroX.
Oh, yeah, thank you. Actually, I'm a stroke or vascular neurologist. I mainly take care of patients with strokes, both ischemic stroke and hemorrhagic stroke, and also the patient with brain aneurysms. So I am Chief Clinical Officer of American Telephysicians and co-founder with Dr. Ahmed of NeuroX. So we started this project almost like over a year ago and launched NeuroX in September last year in Florida.
So Dr. Farooq, and I think that people would like to know what made you inspired to join American Telephysician and also your journey to launch this NeuroX.
Oh, thank you, Dr. Ahmed. Yeah, so really the dedication of the group of the American Telephysicians and how they care about the patients, their families, and how they are changing the vision and how we take care of patients, especially during these difficult times, and patients like stay at home, and we bring everything to their doorsteps. So using telemedicine and the new technology, we bring everything to the patient's home, including not only the televisits, but also the if they need any diagnostic testing, they need any medication, they need any further workup. So bringing the whole clinic, really medicine clinic, and NeuroX will bring the whole neurology clinic to the patient's home, to their doorstep, and make the healthcare very accessible. So these are the key points really which attracted me to American Telephysician, their dedication and how they think about the patient, their families, their comfort level. And the two important things I would like to mention here. Number one is the affordability. So we see many patients, they don't have any insurance. They cannot afford like simple testing or imaging studies. And American Telephysician, through their platform, which is well known nationally as Cura for You. So the patient can go online and they can request labs, any imaging studies. Doesn't matter where the patient is. So we provide services like nationwide in the entire US. And these services are very convenient. So affordability and also the convenience. So these are the key main things which attracted me to American Telephysicians. And we started this new journey of NeuroX. And I'm so actually proud and also very, it's my privilege and honor to be part of this team. And I think we are making a big difference in the patient care and how we can help the patient and their families in these especially difficult times, especially in this COVID pandemic.
Yeah, and you've touched on that subject during these difficult times. I think we've heard more and more about how brain health is so important with people worrying about the pandemic, people that have been closed up and unable to meet with their friends and family is just a small area. But talk to us about brain health and how this is actually helping being able to communicate with people online.
Oh yeah, thank you, Adrian. So really, brain health is my passion, and I have been doing this, taking care of patients with different neurological problems over the last almost more than 10 years. So if we define, brain health, there is no clear definition. There is no universally recognized definition of brain health. And as you know, brain is a very complex organ and control really everything in your body. So it is critical and it is so important to preserve, the optimal brain function and integrity. So if we like summarize the whole thing, that will come down to like memory, cognition, mental function, and also like movements and how we perceive the whole world around us, really. And we have seen, in this pandemic, that how this isolation is affecting the patients, their families. They're so stressful; they cannot see their loved ones, and this entire time has been so hard and difficult for especially for our elderly population. They are confined to their homes, their nursing facilities where they are. They are not able to see their kids, their grandchildren, and whole situation is really affecting their uh, mental health and also the brain health.
Thank you, Dr. Farooq. So one area which is from a physician perspective is well known is a telestroke or tele-ICU in the hospital care. And I know your passion was to extend that care beyond the hospital, especially if a patient get discharged, either go to nursing home or they go to homes there. So tell us about your plans. Where you're seeing this NeuroX helping those patients who are who are discharged from the hospitals, and how NeuroX can impact their life.
So yeah, definitely, Dr. Ahmad, you have mentioned this critical point. So many of the stroke patients we see in the hospital would take excellent care of those patients. Nowadays we can do so many things. We can give the clot busting medication. We can go from groin and try to remove the clot mechanically. And many patients do really well. This is very satisfying for us to see how the patient recover. They come with significant deficit, but they go home and they're walking. So they are really back to their baseline. However, the problem is when the patient go back home, especially during these times, as I mentioned before, the patient are very reluctant to come back to office, for follow-up visit. So if there is no proper follow-up visit, sometime we have to look at, which testing has been done in the hospital, what is missing, which medication is need to be adjusted. Sometimes we start 2 blood thinners in the hospital, and the patient is supposed to stop 1 blood thinner after almost like 3 to 4 weeks. For example, patients with small vessel stroke, we start aspirin and also Plavix, and after 3 to 4 weeks, we stop Plavix, and they continue only aspirin. And we have seen that patients are not coming back for office visit, and they're continuing these 2 medications, and they come up, with GI bleed. So they have to be admitted in the emergency department with other complications. The same thing, sometimes we have to start stronger blood thinner to these patients. We have to repeat a scan, the CAT scan or MRI, after a certain period of time. So NeuroX, what we are trying to achieve is to provide these services at the patient's doorstep. So this is the thing which we need to provide to these patients, so that they need not to worry about travel. Many patients with stroke, they have disability. They have to call their family members. In this pandemic, family members cannot come or pick them up. Patients cannot leave nursing facility. So as I mentioned, they are missing the appointments. So what we are trying to provide the best neurological care right there. Doesn't matter. Patient is at home, nursing facility, memory care unit. We can beam in and see those patients right there and look at them, examine them, look at the medications, and if they need to have some new medication, or if we need to adjust their medication, or we need to order a scan, so we can provide all these services to these patients.
Awesome.
Can you tell me, as a layperson, it will be nice to know that if I see a symptom or a sign on a loved one or a friend, I know there's a lot of things out there on the internet. Oh, watch for this or watch for that. But can you give me maybe five things that I should be watching for?
Yeah, I'm glad you mentioned that. So I will give you a mnemonic. So you might have heard about like fast. Now we call it be fast. So there are different like sign. symptoms of stroke, and if we see somebody is having these symptoms, or if we see these signs, then we should call 911. So B stand for like balance, and E is for eyes, your vision. Somebody has sudden vision loss. So stroke, mostly we see the patient is having symptom all of a sudden. So that is the key point to remember, that if somebody has any weakness, numbness, headache, vision loss, all these symptoms come right away. Like all of a sudden, patient develop these symptoms. So going back on be fast. So if somebody has sudden difficulty with their balance, or they have sudden change in their vision, or if they have any facial droop, or they have difficulty with their speech, or if we see the patient is having arm or leg weakness. So, for example, if we ask the patient to, pick up their arms and they have a drift, so that is a sign that patient might be having a stroke. So, or if patient has difficulty with their speech, we can understand, or they have slurring, or what we call dysarthria, or patient is aphasic. So all these signs are the warning signs, and if we see any of those, this is the time to call 911. So what I tell my patients, and also when we try to create awareness in the community, we tell everybody that if somebody is having these symptoms, don't call your family members, call 911, because the family members can join later on. And if you come to the emergency department by EMS, the patient goes directly to the CAT scanner. So we do the CAT scan right away within 5 minutes. And we have now very special imaging modalities, what we call CT scan angiogram and also CT perfusion. So we quickly do all these scans and decide what we need to do, because the time is critical. Every single second counts in stroke care. So we need to decide about the clot busting medication, or if we need to go with the catheter to the patient's brain to remove the clot mechanically. So if we see any of these signs or symptoms, we should call 911 and come to the hospital right away.
So it's actually critical with the timing of when these symptoms come on and when you're seen by a doctor, because the longer you leave it, the worse the more permanent perhaps damage can be done.
Yes, absolutely. Like in short time, you can lose like millions of neurons if we don't treat those patients in timely fashion. So time is everything. So this is what we call time is brain, right? So
that's where
if we don't treat the patient right away, the patient will have significant deficit, and that is really important, especially if patient has disability, they cannot work, they cannot go back to their job, and that affects patient, their families, and so how much healthcare dollar we spend on all those things and affect the whole community, so we really need to move fast in these patients.
Thank you, Dr. Farooq, for joining us this afternoon. It's been an absolute pleasure talking to you, and also very interesting.
Thank you, Dr. Farooq, for leading that.
Great opportunity.